So our quality improvement programs, annually we have a quality improvement patient safety poster symposium. This is annually in May. We've had 4 of these in the last few years. And each year, the participation by our programs internally and outside of our OSUMC have really taken off. We've had increased participation in an interdisciplinary way as well by involvement of other disciplines in these quality improvement posters. So you'll hear more of that within your own programs, and our residents can work in groups together along with choosing a patient safety initiative, quality improvement initiative that is centered around their discipline. So we look forward to that. And we put out a quality improvement handbook. It is a patient safety project handbook. This is a step-by-step guide in preparing for a poster presentation. Okay, it takes you through how to choose your initial topic or patient safety issue, how to work through that over the course of several months, right up to publication of your poster and presentation. So you'll have more of that to come. And Dr. Crystal David is our chair, and she'll be also giving a presentation later, I think next month, on how to develop a topic and a project. So looking forward to that. Your quality projects, along with your research projects, should be captured as scholarly activity in new innovations. And as you know, new innovations is your resident management data system where all of your resident activity is captured. So please know that your quality projects should be entered there as well. I'm not certain if our site visitors are going to actually request to see this in new innovation, but I think it would be a good idea to be prepared for that. The hospital puts out a monthly QI newsletter as well. We've had some interruption in those newsletters over the course of the pandemic, but my understanding is that they will be restarted on a regular basis. And of course, disaster preparedness is in health streams. We have cultural competency training as well in health streams. So when our site visitors come, they will ask our residents and fellows and anyone that's participating on that site visit if our residents know what this hospital's quality projects and priorities are. And so I'd like for you to just kind of remember these. These are things that we deal with as we care for our patients in our hospital. CLOPSI, so that is central line associated bloodstream infections. CAUTI are catheter associated UTIs and how we reduce those. We have a focused effort around improving care for those patients that are status post-CABG. We have a restraint reduction program. We have a fall reduction program, and of course a fall response team that responds when patients do fall. And we have SWAT. SWAT is for skin wound assessment team. So the SWAT team, in concert with our wound team and our surgical teams, really assist in reducing the incidence of these pressure injuries for those patients that have long-term stays and are bedbound. And sepsis, of course, we all see patients with sepsis, and diagnosing and improving the care and the outcome for these patients is important. And then we have a program known as Up Mobility, where we work to increase the mobility of our patients that have comorbid conditions that might keep them down and in bed. So a lot of work around that. So please know what these are, and it is very likely that our site visitors will ask us, ask our residents if they know what the quality improvement priorities are of this hospital. And each hospital has some of these, but they may have other priorities based on their